It took a little while, but now I'm at least 70% pain-free.
Okay. Is there anything that you couldn't do before the procedure? Anything in your life, your daily activities that you weren't able to do?
Walking a distance without pain was one of the biggest, really even sitting. Sitting was a problem with some of the areas that I had the pain, and that has gotten an awful lot better, especially the walking.
Okay.
That has gotten a lot better.
Okay, good. So now that we've done the procedure, you've noticed that you're walking better.
Mm-hmm.
And sitting is more comfortable.
Mm-hmm.
Now, are you a candidate for a hip replacement?
Not at the moment.
Excellent.
I am at some point, they think, but that could change.
Okay.
You know, I really believe in this PRP and that it helps to heal it and put off the hip replacement.
Because we were thinking you were heading in that direction, and someday you might.
I very much was heading in that direction.
Yes.
I was ready to schedule it.
But now that your pain is better and you can go about your daily activities, it's not an urgent thing, and even the surgeons are telling you to wait, right?
Yes, they are, definitely. And I just really believe in the way you do it and how you're doing it and the volumes that you're using. I know there's a lot of places out there that do it. I don't think I'd trust anybody else to do it.